In this video, we'll discuss about superficial mycosis. Superficial mycosis is the disease of outermost layer of skin. It is a disease of outermost layer of skin and its appendages. Physically here there is no pathology due to their presence. So patient would not have any severe complication. Patient may be unaware of this condition. So it is the outermost layer of skin disease. No pathology. So patient would not have severe complications. Superficial mycosis have various causative agent. First one is Pityriasis versicolor. It is also known as Tinea versicolor. Pityriasis versicolor have also known as Tinea versicolor. The causative agent is Malassezia furfur. Malassezia furfur. Second disease Tinea nigra. Tinea nigra caused by causing agent Harta Bernehi. Then black Petra and white Petra. These two are the disease of hair. Physically, they produce nodules like structure in hair, and this disease are very common in community, but people unaware of this situation because they are not causing much of that problem. So what are the four superficial mycosis causing agent? Pityriasis versicolor, causing agent Malassezia furfur, Tinea nigra, Horta Vernegi, then black Pietra caused by Pietra Hortae, Pietria Hortae, and white Pietra caused by Trichosporon vegeli. So these are the causing agent and disease of superficial mycosis. So first we will discuss about Tinea versicolor. Tinea versicolor is also known as Pityriasis versicolor. It is common skin infection with fungus of species Malassezia furfur. Malassezia furfur. It is also known as Pityrosporum ovale. This one also called as Pityrosporum ovale. So first one is Tinea versicolor. It also known as Pityriasis versicolor. Causing agent Malassezia furfur. It also known as Pityrosporum ovale. It is worldwide phenomena, but most commonly in tropical climate. Adolescent and young adult are mostly affected, and this condition can be associated with skin conditions including folliculitis and seborrheic dermatitis. So skin disease, folliculitis, seborrheic dermatitis. Some of the risk factors: summer month and hyperhidrosis. That means it causing excessive sweating. Hyperhidrosis. Then chronic steroid use. Then cushioning syndrome or disease. Then immunosuppression. So these are the risk factor associated with the Tinea versicolor skin infection. Summer month, hyperhidrosis, chronic steroid use, cushioning syndrome or disease, and immunosuppression. Next, what is the pathophysiology? It is due to fungus Malassezia furfur. This Malassezia furfur is a part of normal flora. It is a normal flora only. But what happened? This Malassezia furfur, this yeast cell transform from pathogenic mycelial form. So yeast cell form is transformed into pathogenic mycelial form. Why it transform? Why yeast cell will transform mycelial cell? Because of acid. That acid name is called as azelaic acid. Because of azelaic acid, what it is transformed into mycelial because of it producing azelaic acid. This azelaic acid, uh, because of this condition, this azelaic acid causes inflammatory reaction, causing dysregulation of melanin, whether overproduction or less production. Because of this alazic acid overproduction, dysregulation of melanin, whether overproduction or less amount of production. So less melanin production or increased melanin production. So altered melanin production causes alteration in pigmentation. So this is the characteristic changes skin color in tinea versicolor. In typically speaking, hypopigmentations occurs in summer. More sunlight exposure, so more melanin production. Second one is hyperpigmentation in the winter month. Because of less sunlight exposure, so less production of melanin. So skin color change because of hypo and hyper melanin production. Hypopigmentation occur in summer, hyperpigmentation occur in winter. Next, what are the sign and symptoms of tinea versicolor? Often asymptomatic, but we can see characteristic skin in sign. So we can see hypo and hyperpigmentation, pigmented hypo and hyperpigmented skin lesion. That this one will causes scalaring macules or patches, also seen in macules, patches, thin blades. So most often on the trunk, proximal extremities, face and necks are affected. Next, how to diagnosis and treatment. Diagnosis, clinically, that clinical diagnosis, fungal hyphae isolated by microscope using KOH preparation. Then treatment purpose using topical antifungal agent like derbinan. Treatment, we are using derfinafin, cyclophyrax, ketoconazole cream. Then selenium sulfide and pyrithinone zinc. These are the drugs used for treatment of tinea versicolor. So superficial fungal infection notes format, it causing disease under the skin, causing agent tinea versicolor, tinea negra, black pietra and white pietra. First we are discussing tinea versicolor, causing agent Malassezia furfur. skin disease, folliculitis, and dermatitis. Thanks for watching.